Hi, my name is Karen Harpster. That's really loud. I am an occupational therapist and researcher at Cincinnati Children's, and I'm happy to be here with you today to talk about cortical visual impairment. Just to give you a little bit of a background, at Cincinnati Children's, we all got trained by Dr. Roman Lancy a couple years ago, and we've been doing assessments and treatments for kids who have cortical visual impairment for the past couple years. So why is it important? CVI is one of the leading causes of visual impairment, and it affects a lot of children who have CP. I think the latest thing I read was 60 to 70% of kids who have CP also have CVI. Visual skills, as we all know, if you have decreased vision, it's going to impact every aspect of development. So whether you're learning to walk or crawl or reach or grab, learn your letters or learn how to read, if you have decreased vision, it's going to have a significant impact. So there are two types of visual disorders. The first type of visual disorder is an ocular disorder, and that's where the pathology of the eye is impacted, so you're not seeing, and there's difficulty with the actual eye pathology. And then there's also neurological disorders where there's an impairment with the processing center in the brain. And so CVI is considered a neurological visual disorder, and it's considered one of the fastest growing visual disorders today. So one thing that we often see, so the way we usually get referred kids is that they see the ophthalmologist and they have a typical eye exam, and the eye exam doesn't explain how they're seeing. And so there's a difference between what the ophthalmologist is seeing and how the child is presenting. So what's happening, what we think, is that the brain doesn't process or understand what it's seeing. And so there's several medical conditions that are commonly associated with CVI. PVL, asphyxia, hypoxia, stroke, hemorrhage. There can be abnormal structures in the brain. We see a lot of babies with shaken baby syndrome, or it can be a metabolic disorder. And so I'll start off by saying a lot of our treatment approaches we get from the CVI range. The CVI range, it was created by Dr. Roman Lancy. It's an assessment of functional vision, and the thing I'll talk mostly about today is the 10 characteristics that are common in kids with CVI. So the first one is color preference. And so most kids who have CVI have a color that they see better than other colors. It's usually something that's bright and prevalent, but it's not always. You'll hear a lot of times people will say it's red or yellow, but it's not always red or yellow. It could be something that you're exposed to early on in life. So if you have a favorite sports team or something that you have a lot of that color around, that might be your child's favorite color. And color preference is often used, as you'll see it a little bit later, in some of the treatment strategies that we often use with kids who have CVI. The second characteristic is need for movement. And so movement helps a child capture their visual attention. And so the reason why you see a lot of shiny things on the screen is because shiny or reflective is considered moving. And so a lot of times that will help capture the child's visual attention. But then on the opposite end of the spectrum, it can also take their attention away. So if they're in a classroom that has a lot of movement, if they're doing centers or something like that, it might be hard for the child to attend to what they're doing because there's a lot of movement happening within the room. So it can be a help, or it can be a hindrance. The next is visual latency, and so what that means is it might take the child some time between when you show them an object to when they actually see it or when they process it. So the thing to know important about that is that if they need extra processing time, that it's important that they have quiet waiting. So if you're talking to the child and they're trying to use their vision, and there's a lot of auditory things that are happening, it's going to be really hard for them to use their vision and their sight at the same time. So as therapists, we tend to talk a lot, and it's often, we have to warn the parents that, this is going to be different than probably anything you've ever seen. I'm probably not going to talk while I'm showing him these toys, and there's a reason for that, and it's because he might not be able to see something while I'm talking at the same time. The next is visual field preferences. So some kids who have CVI often have a preference. So they might see better on the right side or they might see better on the left side. The most difficult visual field for them to see is directly in front of them or also the lower visual field. So if you have a child who's walking around and they're navigating the community, that you might find them tripping over curbs, or if there's a change in the surface, like grass to sidewalk, they might not notice that, and it might kind of throw them off balance. So just knowing that if you have a child who is starting to use their vision, we use that preferred side to help them start to use their vision. When you have a child who's using their vision consistently, you might challenge them and put some things on the other side. So it really depends on where your child is in his phase of using his vision, how you want to use that field preference. The next thing is visual complexity. So when we think about visual complexity, we think about the complexity of the object. So the toy that the child's playing with, does it have multiple colors? Is it one color? Does it make noise? Anything about the object. And then you think about the complexity of the environment. So is there a lot of noise that's happening? Thinking about this room, the rug is very complex. So if you have a child who's crawling and they're looking down and there's a toy on the floor, it's going to be really hard for them to find the floor because the rug is very complex. So we think about it on a lot of different levels. So the complexity of the object, the complexity of the environment. And so the other thing I think of too, if I'm holding up a toy in front of my shirt and it's white, it's going to look different than if somebody has a red shirt and they're holding it up. That's going to look like a different thing to a child who's just starting to use their vision. This is just an example, 2 pictures. If you have a child who needs a low complexity background, you're going to look to the left. And if you have a child who can handle a little bit of complexity and you want to challenge their vision, you might set up their eating space like the one on the right. The next characteristics that we look at is light gazing. And so for a child who doesn't use their vision a lot or is just starting to use their vision, they're often going to look at the overhead lights, or maybe if you have big windows with lights, with the light shining in, they're probably going to get distracted by the lights. Your brain can naturally see the light, and when you're having a hard time processing the world around you, you are going to want to naturally look at the light. So we use that light to our advantage. So the picture that you see on the bottom is a therapy environment that's the complexity is pretty low, and we're trying to get the child to walk to the ball. The child's color preference is yellow, and there's a light box behind it. So we're using some of the strategies that will help capture the child's visual attention to get them to walk across the room. Just something to think about. And then the other thing is that a lot of children with CVI often do well with a backlit tablet, like for a communication device or something, because that light will help attract their vision. The next characteristic is distance viewing. So a lot of kids who have CVI have a difficult time seeing things that are far away. You'll often see kids who are just learning to use their vision maybe hold something up close because distance is harder, and the reason that distance is harder is because the farther you are away from something, the more complex the background gets. So if I hold this paper up to my face, I'm just seeing the paper. If I hold it out here, then I have to take in the background information plus the paper. So that's one of the reasons why distance viewing is a little bit hard for children who have CVI. And so thinking about that from a clinical perspective, when I'm playing with a child who's just starting to use their vision, I'm going to hold things up pretty close to their face. But if a child's starting to use their vision a little bit more, then I'm going to extend that backwards so that they're having to challenge themselves a little bit more. The next thing we look at is atypical visual reflexes. So we do 2 reflexes. We touch the bridge of the nose to see if the child will blink. We look to see if they have a blink response, and if the blink response is latent or is it immediate. And the next thing we do is we bring a quick moving object towards their face to see if they blink. And again, it can either be absent, present, or just a little bit delayed. And that's something we educate the parents about, because if they don't have a blink response and they're around other kids who might be playing ball or something like that, it might be a little bit dangerous if they're not aware of that, because they might not blink and might get hit with the ball. The next thing is visual novelty. So most kids who have CVI will see things better that they're familiar with because they already have a visual schema of what that is. So if I'm thinking about a baby that I'm treating who's not really using their vision that often, I might ask the parents to bring some toys that don't make noise that they're familiar with. So a lot of times that might be even just not even a toy, it might be their binky, or it might be a favorite sippy cup, or it might be a rattle or a toy, because they've seen that toy a lot. They have a visual schema built up of that, and so they're going to see that a little bit better than if I were to bring out a whole new set of toys that they've never seen before. The other thing, we often encourage parents, if you have a child who is just starting to use their vision, to play with the same 3 to 5 toys over and over again until they're consistently looking at them. I think it's important to teach that to therapists too, because we don't want the kids to be bored, and so we'll want to bring out new toys every time. But for a child who's not processing visual information, that can be really difficult. They may have difficulty looking at new people, so new faces. Faces are very complex and they move a lot, and it's hard to understand that for a child who has CVI. And a lot of kids who have CVI are not going to be looking around in their environment to find new things. They probably are going to look away from things that might be new. Absence of visually guided reach. So a lot of kids who have CVI will, if they're reaching for things, will look at the object, look away, and then reach. It's really hard for them to use their vision and their motor skills together. They also might, instead of, they might see something out of their peripheral vision and feel for it and not look and reach at the same time. So they're two of the things that we often see with kids who have CVI. So I'm not going to get into the phases a lot, but I wanted to give you some practical strategies of ideas that we use a lot of the time, or we teach parents about in therapy. So phase 1, and these are based on the CVI range. Phase 1 is for a child who's just starting to use their vision or not using their vision at all. So their job during this stage is to try to build up some consistent visual behaviors. Phase 2 is a child who's starting to use their vision a little bit more regularly, and we want them to start to integrate their vision and function into their functional routine. So they're starting to maybe hit a switch to make a toy activate, or they're starting to, on a surface that's not complex, instead of handing them their toothbrush, we're going to have them find their toothbrush on the sink. A kid who's in phase 3, they're using their vision pretty regularly, but they're not curious in new environments especially, so that we're starting to build up their vision in different environments. So phase 1, what I'll go over now is there's some common behavioral characteristics that will help a child who's in phase 1. So kids who are in phase 1 have a strong color preference. So this is where you're probably going to be using single colored objects. You're probably going to use objects that either have a direct light source, or they're going to have shininess. So that's going to help the child engage their visual attention. They're also going to have, like I said, a preference to things that move. So you're either going to move something while you're holding it, or it's going to be shiny. Or we use a lot of Christmas balls with flashlights to really get that shiny effect, to try to for a child who's not really looking at a lot, to get them to engage their visual attention. One of the most important things here is quiet waiting. So if a child's not using their vision and you're talking while you're giving them an object, they're probably going to use their hearing and not their vision to find the object. You see this slinky up there. Kids in phase 1 tend to, because you can put a flashlight in it and you can make it go up and down. So it's pretty good at capturing their visual attention, but they make noise. So you have to get pretty good at making it go up and down without making noise, because you don't want them to hear it, you want them to see it. We often hold objects within 6 to 12 inches from their face until they're starting to consistently look at that close of a distance. And like I said before, 3 to 5 objects. You want to use the same objects over and over again until they're consistently looking at them. If you're changing up the objects over and over again, that's going to be really hard for a kid who's not using their vision regularly. You also see a light box there, so we often put a lot of things on a light box to help the color capture their attention, and whatever their preferred color is the color of the object you would put on a light box. Kids who are in phase 2, this is when the kids are starting to use their vision a little bit more, so they're definitely looking at things. They might be maintaining eye contact on the object for a couple seconds or even up to a minute. So you can start to move away from the single colored objects to start to challenge them to have an object that's 2 or 3 colors. When you do that, you want to transition and have one of those colors be their preferred color. So if their preferred color is yellow, you want to maybe have something that's yellow and red. I just thought of something that I didn't say with phase 1 that I wanted to tell you. So if you have a baby who has CVI, or even a toddler, probably toddlers the hardest age for phase 1, because if you think of toddler toys, they all make noise and they all have a lot of colors. One of the things that we have done in the past is got some spray paint and spray painted some toddler toys so that they're not all the bright colors, and then just cut out some Mylar paper and put one color on the things that you want them to press. Because a lot of the infant toys have so many colors and they're really loud. So that's really hard for a young child who's in phase 1 and has CVI. The next thing is the environment. So we always have to be cognizant of what's happening in the environment when you're wanting the child to use their vision. So if it's really loud or if it's really busy, it's going to be hard for them to use their vision. So that's where, you put up a black trifold if it's a busy environment to kind of minimize the visual complexity. Or we might put, if they're working on homework, we might put their desk against the wall so they're not having to look at all the other kids walk around in the classroom, because that might be distracting. So thinking about the environment, the noise level, the amount of complexity, and the amount of movement that's happening around them is going to really impact their ability to look and do things. The visual targets, at this point, we're not quite at the 6-inch mark. We're going to put a visual object about 18 inches or so away from their face. You always want to challenge their vision. As their vision improves, you want to make it a little bit more difficult because you want them to progress. And then the kids in phase 2 are going to start to look at books or 2D materials, but really simple books. I think on the next slide, I moved around my slides a lot. I'll show you a book in a minute. With kids who are in phase 1, the pictures that you see up there, they're called PECs. And so we use them with a lot of kids. The picture of a drink doesn't really mean much to a child who has CVI, they're having a hard time processing information. So instead, we would use a picture of their actual cup that they use at home, or their plate that they use at home. So instead of having a picture of somebody eating that they don't know who that is, we're just going to give them a picture of their plate. If you want to work on buttoning, this is obviously from a therapy perspective, you're using a schedule, you're going to use the actual vest that they're going to button instead of a non-important button picture. If you have a child who is a little bit older and likes to go to the zoo, so the distance viewing, if you remember, if you think about the zoo, it's really hard to see things that are far away. So you might want to take a picture of the animal that they're looking at and zoom in on it, so they're really just seeing the animal. They don't have to take in the background and everything that leads up to the animal. They're really just looking at the animal. So you're in real time. You have an iPad. They're looking at the manatee. You get a picture of the manatee. You blow it up a little bit, and then they can actually see what you're looking at also. When they're learning to make letters and shapes, we often use 3D materials for them to learn what it is and what it feels like, and then when they understand that, then we'll move on to a 2D worksheet, like a handwriting without tears worksheet. The duck in the middle, if the kid's preferred color is yellow, you might use that to draw them in so they're understanding that that's a duck. A duck starts with the letter D, and that's kind of what I'm doing here. So again, even though the child's seeing multiple colors at this time, you're going to use their preferred color to bring them back in when they're learning something new. Another example, you might have a child who likes to look at animal books, and this is a pretty complex page. You might want to take a picture on the iPad and blow it up a little bit so they're really just looking at the seal on the page rather than that whole complex page, because that might just be a little bit too hard for the child to process. Kids who are in phase 3, this is when they're really using their vision a lot. They might not be curious in new environments, but they're really doing a really good job using their vision. The things to think about with kids who are in phase 3 is that they might have difficulty when they have like worksheets that have a lot of problems on it, or if they have like that book that has a lot of information on it, they might have a hard time knowing where to focus their attention. They might have difficulty with distance viewing still, and especially in unfamiliar environments. So you're at Target and they want to find a video game that they want on, if you think about what that would look like for a child who has CVI, lots of boxes that are all the same size, trying to figure out where to find that specific video game might be hard for a child in phase 3. They often might still not look and reach at the same time, especially if they're looking for something on a crowded background. So if they're working on, a worksheet, or, if they have a desk with a lot of materials on it, that might be hard for them to look and reach at the same time. New environments are going to be difficult, so you're driving in the car and you're trying to find a sign for, a new museum that you're going to go and find. Even though the child might be able to read, it might be hard for them to find that in a new environment. The other thing, so if they're transitioning to a new school or a new daycare setting, they might have a hard time with that because they're not familiar with it. So one of the strategies that we teach parents is, take them there a couple days before school starts and let them see what it looks like with no kids in it and when it's not really loud and really a lot of things happening. So let them get familiar with the new environment before they actually have to be there. I think one of the biggest things that we do for really any kid with CVI, but really kids in phase 3, is narration. So kids with CVI have a hard time knowing where to focus their visual attention. So if they're trying to find their video game in the store, you might say it's on the shelf closest to the floor and it's next to all the games that are green. So that's going to help them know where to look. Or you're in a new medical building and they want to find the elevator, and you say, it's on your left and the buttons are red, to help them, understand where they want to look. And then sometimes, even though a child's looking at something, doesn't mean they're seeing it or processing it. So if you can tell they're still having a hard time, you might say, what are you looking at? Tell me what you see. And then they'll kind of, be able to tell you what they're seeing or why they're having a hard time figuring out or finding what you want them to find. So just some pictures. If you think about a playground at lunchtime in a school where the kids all wear the same uniform, a kid who is even in a phase 3 who has CVI, they're going to have a hard time probably trying to find their friend because they might all look the same, compared to when you're going there after school and you're the only ones on the playground. When we're teaching kids how to write how to form their letters, we're going to break it down into steps, and we're going to use 3D objects to help them understand that a capital D has one big line and then one big curve, and this is what it feels like, and this is what it looks like, and giving them some, verbalize them through it, and then also give them the sticks to kind of go with it. When we're working on transitioning to 2D materials, we might work on some things like this. Here's Dory. On the left, he's by himself, but then on the other page, he's in with other kids. Can you find Dory on this page? And then same thing with the bunnies. Can they find the bunnies that are the same or the same color? Kids who are in phase 3 might have some difficulty with reading or following the lines. So this is just a translucent, divider. And two different ways. You can just cut a strip out for a kid that might not need as much support, or you might cut a black piece of paper and put the strip in the middle. The strip would probably be the child's preferred color, and you can just move it up and down as you read. A math adaptation, so a child who sees all colors, but their preferred color used to be yellow, you might use that color to help them understand where they should put the numbers to the math problems rather than it being all over the page, just to give them some structure. Same thing when they're learning like sight words, you might outline the sight words and so that they're able to understand what the word looks like. Or the picture on the right is just a trifold folder cut into 3 sections. So if for a child who might need less distraction, they can only focus on one problem at a time, they might just open one piece at a time. So then One thing that I always tell parents and teachers and people that work with children who have CVI is that if you're working on something that's routine or easy, you can challenge the vision. So they're brushing their hair, and they do that every day. Have them find their hairbrush on their sink instead of handing it right to them. Let them use their vision and look for it. But if the task is cognitively hard or motorically challenging, then you want to minimize the visual demand. So this might be a kid who might not need a black divider up, but for something that's really difficult for them, like in school with a lot of movement, they might need that modification, although they don't need it all the time. But when we want them to work on new concepts, they might need that adaptation. So just to give you a couple examples of what that would look like, if you have a child who's starting to, probably a phase 2, starting to use their vision, you might have them on the left-hand side find their toothbrush with not much distraction there. And then a child who is in phase 3 and uses their vision consistently, you might not have to clean up the sink in order for them to be able to find their toothbrush among a busy or messy sink. Same thing with like a school worksheet. If a child who's just starting to learn addition, you might have a black cover-up to only show 1 or 2 problems at a time, or you might have a sheet that only has 10 problems on the whole page with bigger print. But if they're proficient at vision, they might not need any accommodations like you see all the way on the right-hand side, or they might just need a little bit of highlighting and not as much minimalization on the math problems. Some publications that I think are helpful, there's the CVI book from Dr. Roman Lancy, and then Little Bear Sees is a book that a lot of parents find helpful when you're learning about what CVI is. And then a couple websites that are helpful. There's the American Printing House for the Blind that has actually Dr. Roman Lancy's book and probably Little Bear Sees, I'm not sure. And then some other things like the light box or toys that are commonly used by children who have CVI. The Department of Education in West Virginia has quite a bit of CVI resources on there, including some videos from Dr. Roman Lancy and some materials that are helpful. There's a Pediatric CVI Society. There's not a ton on their website, but they do have a conference every year that's pretty well attended by parents and teachers of the visually impaired, orientation and mobility, and then some doctors and some therapists. So that usually happens in June or July, and it's usually in Nebraska if that's something you're interested in. And then Perkins has quite a few learning resources on CVI. They also have, they just started this CVI endorsement, and that is where you can find a list of people who do evaluations for CVI who have been certified that they're doing it reliably. So that's where you can find that. So in closing, hopefully I didn't go beyond my 20 minutes, I probably did. One thing we just need to all raise awareness of CVI. There are so many people that have never heard of it, even teachers and therapists that haven't heard of it, and really we need to let them know about it so they can help the children with CVI to the best of their ability. By raising awareness, we're going to educate them about the 10 characteristics of CVI and some of the accommodations that might help your child, and advocate for them. Because especially if you have a child who's in like phase 3, it's sometimes, teachers and therapists, they don't see it because they do a lot and they're really functional. So I think just being an advocate for those children is really important.